Very warm welcome and good evening to everybody. Welcome to tonight's webinar, which is Learn About Multiple Sclerosis for Recently Diagnosed. I'm Nicola Graham, I'm your facilitator for this evening, and our presenter is the very wonderful Jane Bridgman. So hi Jane, thank you for coming along this evening.
Thanks for having me, Nicola, and lovely to join you all online.
So we do like to start all of our programs with an acknowledgement to country. So in the spirit of reconciliation, MS Limited acknowledges the traditional custodians of country throughout Australia and their connection to land, sea and community. We pay our respects to their elders, past and present, and we extend our respect to all Aboriginal and Torres Strait Islander peoples today. So it's with great pleasure that I introduce today's presenter. So Jane is a registered nurse. She's had 7 years of experience in disability, aged care, progressive neurological and primary health care. She's an internationally certified MS nurse and she works as an MS nurse advisor. In fact, normally Jane and I are practically sitting next to each other in the office in Blackburn. So some of you may already have spoken to Jane when you call up MS Connect and speak to a nurse advisor. Jane is one of the nurse advisors on the end of that line.
Thank you, Nicola. How's that going?
That's perfect. We can see your slides.
Lovely. So what we're going to do today is have a look at what MS is and really, from the lens of a person that's newly diagnosed. We're going to have a deeper look at why it happens, where does it occur, some of the lingo like lesions and relapses, looking at symptoms, an overview briefly of the types of treatment that we use, and also we'll be finishing with some of my top tips for you. I won't be going into great depth into this presentation on each topic because each of them could be their own webinar. So if you feel like you still have more questions or there's a specific topic that you're wanting to know more about, don't hesitate to reach out. You can contact MS Connect and pop in a request to have a chat with one of the nurses and we'd be more than happy to cover that for you. So what is MS? Well, over 25,000 people in Australia have MS. That's more than 2.3 people worldwide as well. 3/4 of all people with MS are women, and it's not preventable or curable yet, but I'm really hoping that that does change for us soon. It's not contagious at all, but it is a lifelong condition. So it is a chronic health condition, and we consider it to be demyelinating, which means it takes away the myelin, and we'll learn a bit more about that later. It's also an autoimmune condition, which means that your own immune system attacks your own body, and it's attacking specifically your central nervous system. It is a lifelong condition, but it's not a terminal one, and we really don't fully understand the cause, but we do know a few things about it. In terms of genetics, we know that it's not purely a genetic condition. It is more common in people who have a relative with MS, but you don't inherit MS the same way that you inherit your hair color. If you had an identical twin with MS, meaning you shared 100% of your genes with that twin, if they had MS, your risk of developing MS is approximately 25 to 30%. So that leads us to believe there's still a bit more to it than genes. If you have a parent with MS, perhaps, your risk of developing MS is about 3 to 5%. It is also more common in people who have had certain common infections like glandular fever, and that's being looked into further through research. We also know there's an environmental link. I'll let you have a look at that world distribution map of MS for an example. It's more common in countries further north or south of the equator. So we've identified many things in the environment which make a person more likely to develop MS. One of those things is vitamin D, for example. We know that in Australia, MS is actually more common in Tasmania than it is in Queensland. So where does it occur in your body? Well, we know it's a disease that affects the central nervous system, And the central nervous system is made up of the brain, the spinal cord, and the optic nerves, which are kind of connecting your eyes to your brain. The CNS, which is what we use to call it for short, contains nerve cells called neurons, and they're responsible for sending and receiving information from different areas of the body. That's how we can lift our hand to wave at someone or swallow when we're eating. And so the damage caused in MS is from our immune system attacking that central nervous system. So what happens inside the CNS? Well, it's all based around a neuron, and that's the fundamental cell of the brain and nervous system, also called a nerve cell. Messages called an action potential travel along the nerve from one to the other, and that's how they cross through the nervous system. We also have these cells called oligodendrocytes, and they're a type of cell that produces myelin. And myelin is that insulation-like fatty substance that covers the nerves. There's also something called the blood-brain barrier. That lines the brain and spinal cord, and its job is to keep certain things out and allow certain things in. So in MS, we think there's a breakdown in the blood-brain barrier, and that's the early stage. If it's damaged in some way or weakened, then some of these immune cells are able to cross into the brain or the spinal cord or the optic nerve area and cause damage. So we covered that MS was an inflammatory demyelinating condition. Let's take a tiny bit of a deeper dive into that. So the main processes are inflammation, and that's caused by those white blood cells attacking and causing damage to the nerves. We then have demyelination. The insulation of the nerve is stripped away, that myelin is gone, then that nerve won't work as well. Sometimes the demyelination can cause the nerve cell to die, and that's called neurodegeneration. There can also be a failure to repair. So sometimes the brain can repair this damage, but not always, and not always perfectly, or sometimes not at all. This can result in the death of a nerve cell, and that over time can also lead to an accumulation of symptoms. We do, however, know that neurons naturally die off with age. And so this loss of neurons can actually affect your cognitive reserve. And cognitive reserve is so important in MS because it can protect you against the negative impacts of MS over time. For someone that has had MS for many years, they may not have noticed any impact from a particular lesion. However, as their cognitive reserve declines over time, they may start to notice this lesion having an impact. And that's why it's so important to act timely and prevent as much as possible. So let's have a deeper dive into looking at MS lesions. Lesions are the sites or areas that the damage occurs at. We can call them plaques or lesions or scars or spots. The term multiple sclerosis just means many scars. The term lesion is what we use to describe those little areas. And you can see here, there's an image of the brain, and some of them are quite easy to see, those little white spots. But on the spinal MRI, there's a lesion there that you might not see unless it was pointed out to you. Generally, the symptoms of MS will correspond to the areas of the brain or spine that have been damaged. However, it can be difficult to pinpoint exactly. MRI also helps to differentiate between the active and the non-active lesions via the use of contrast called gadolinium. Some of you may have already had MRIs with gadolinium, or sometimes called GAD for short. Sometimes these lesions will repair themselves and then not show up in future scans, but some will be permanent. Research tells us that about 1 in every 10 lesions will result in a relapse, but it's also important to note that not all lesions are MS related. There's many other causes of lesions, such as migraine or stroke or general aging as well. MRI is also used to monitor brain atrophy or brain shrinkage. Brain atrophy is actually a normal process of aging. Our brain gets to its maximum size from about the age of 25, and from that age onwards, our brain starts to shrink in size over time. In MS, this can happen a little bit faster as well. So again, that's why we promote early diagnosis, so that then we can look at things like treatment and living a brain healthy lifestyle. So let's have a look a little bit more at the diagnostic process. I'm sure many of you will be looking at this list and saying, yes, I've had a few of those done, but maybe not all of them. The diagnosis of MS often brings confusion and many questions. For some people, it can happen all of a sudden, and for other people, it can take months or years. It's not necessarily an easy condition to diagnose because there's no single test that can positively tell you if you have MS or not. Most people are diagnosed between the ages of 20 and 40, but it can affect people that are younger and also older as well. On average, it's about 10 Australians that are diagnosed with MS every week. For some people, as I said, it's quite quickly, and they may get straight into things like their medical history and the MRI, and for other people, they'll have to have lots of other tests. So we also look at things like neurological examination, where a doctor will check your movement, your coordination, maybe your vision and your balance, reflexes, and other senses. And that can help not only suggest whether you have MS, but also indicate where in the central nervous system that damage has taken place. Blood tests can't tell us whether you have MS, but they can help us rule out other conditions. There is research underway to develop a blood test to diagnose MS, but it's not quite ready yet. We did cover MRI, which uses powerful magnets, so there's no radiation involved, and that's what we use to pick up that damage. There's also something called a lumbar puncture, or you may know it as a spinal tap. That's a procedure where a doctor will extract a really small amount of fluid that it's found within the central nervous system. That fluid is called cerebrospinal fluid. They do a test on that fluid to look for something called oligoclonal bands. And that's not normally found in the CSF. So if a result comes back as negative, it doesn't mean you don't have MS, but a positive result supports the idea that you do have MS. So that's why that test is not, I would say, perfect in being able to diagnose MS. There's also other things like evoked potential tests as well. And so that leads us to the type of MS. I'm curious to hear about whether you know how your MS has been classified. Feel free to pop that in the chat or ask any questions as we go along, and Nicola will share them back with me so we can discuss. MS does vary greatly from person to person, and everyone does experience it differently. There are, though, these categories that we use to describe the broad pattern of the MS and how it behaves. The most common kind of categories that are used would be relapsing remitting MS, secondary progressive MS, and primary progressive MS. Majority of people are diagnosed with relapsing remitting MS. That's approximately 85% of people, and most of them are women as well. The main feature is a fluctuation of symptoms. So there are times of acute symptoms, known as a relapse, followed by periods of remission. People with relapsing remitting MS can experience fluctuations in day-to-day symptoms as well, but that's not necessarily the same as a relapse. Some people who are initially diagnosed with relapsing remitting MS may find that actually over time their MS changes. So there are fewer or no relapses, but disability is increasing. And that's called secondary progressive MS. It's called secondary because the progressive phase happens second, after the relapsing remitting stage. However, a small number of people will be diagnosed with secondary progressive MS from the very beginning. In hindsight, maybe they experienced relapses in the past, but they were mild or maybe misdiagnosed, but not always. And then there's also primary progressive MS. Some people who are diagnosed with MS won't experience those kind of clearly defined relapses. That's about 10% of people. The main feature of primary progressive MS is a constant pattern of symptoms from the time of diagnosis. There could be periods where the symptoms are stable or even improve, but overall, there's a loss of function that tends to increase over time. relapse. And Nicola, I'm keen to know, how did we go in finding out whether people understood what type of MS they had?
Yes, so we haven't got any questions yet, so nobody's popped any questions in. I'm just going to quickly check the chat. No chat, so please, guys, pop in as Jane requested if you know if you've been diagnosed with what particular category of MS. That would be great to hear from you. I'd encourage you to pop it in the questions, and I can see now that some people have started to put that in. So but relapsing, remitting MS, 5 people so far have responded that that's what they have. So currently, people have all responded with relapsing, remitting. Yeah, everybody so far. And we've had 10 people respond. Alice is saying she was not told at her first appointment, but worked this out through her own research and then confirmed it at the next consult. So yeah, but everybody are MS currently.
And that can be really tricky because there isn't a clear test to define which type of MS you have. So it really is the neurologist's kind of assessment of how the MS is behaving that tells us what kind of MS we think you have.
And Jane, we have got one person attending here who's had MS longer and is now secondary progressive. So,
well, thank you for sharing. So, looking at the relapse, which is the relapsing part of relapsing remitting, a relapse may also be referred to by other names, such as an exacerbation, a bout, an attack, a flare-up, or an episode. A relapse is formally defined as the development of new symptoms or the temporary worsening or reoccurrence of old symptoms. Importantly, though, we need to rule out a few things. It needs to be not caused by an infection or any other cause, and it needs to last for more than 24 to 48 hours. And it also needs to be at least 30 days after any previous episode to be considered a new relapse. Otherwise, it would be considered part of an old one. A relapse may occur quickly with a sudden and intense onset of symptoms, or gradually with symptoms appearing over a few days or weeks before it gets to the peak and then slowly goes through the recovery stage of that relapse. For some people, they may experience mild symptoms and be unsure if it's a relapse, and for other people, it can be quite noticeable. If you're not sure if you're having a relapse or not, do get in contact with your neurologist. It's really important for them to be able to do that assessment for you because they may need to put other things in place like assessments or treatments or even review your long-term treatment. Relapses can be treated with steroids. They help the relapse resolve faster, but they don't have much of an effect on the ultimate level of recovery. We can see here that even though the first relapse has recovered all the way back down to baseline, the second relapse in this example, there wasn't a complete recovery. So there can be some residual symptoms from a relapse that will then stay with a person ongoing. So looking at these symptoms, I'm keen to hear about your experience with symptoms. You can pop in the chat what symptoms you've been experiencing because we'll be very interested to know about what your experience is. There can be many symptoms of MS, but not everybody experiences them all or to the same degree. Many of them are visible to other people. They're the ones we've put in bold, but also some of them are not easily noticed. Everyone's MS is different, so no two people will have the same range of symptoms or even severity, even if they're really closely related. Some of the common MS symptoms are invisible. Things like fatigue, for example. You can't see that on someone, perhaps, unless they're showing physical exhaustion. So we can't really tell what a person is experiencing just by looking at them. So you may find that family, friends, or work colleagues may not recognize the challenges that you're going through because you don't look sick, and you may hear that, and it can be very frustrating. So what happens after diagnosis? Well, looking at the medical care, usually you'd be under the care of a neurologist for ongoing care. We're looking at 6 or 12 monthly appointments. It could be in the public health system where there's often really good MS clinics, some of the very big hospitals in the major cities, or you could be under a private neurologist. These neurologists are not usually available to call any time, day or night, and it can be hard to get a quick response from them, but they do usually get back to you and provide a very good level of care. It's best practice for clinicians and general neurologists to refer people who are suspected of having MS to MS specialist neurologists. These neurologists that are MS specialists have access to the latest diagnostic criteria, facilities, and also an experienced MS healthcare team. They are then kind of best placed to guide you in your new diagnosis and understanding your treatment and management options. These MS specialist neurologists also have aligned their prescribing guidelines with the latest treatment recommendations. So we can see that after kind of looking at that initial phase of being seen by a doctor, we might decide what type of MS it looks like it is, may need to treat some acute symptoms. There may be symptoms you have that need treating right away, whether they're symptoms or a part of a relapse. Then look at, is long-term therapy appropriate? Because MS is treated with disease-modifying therapy often, which is started soon after diagnosis and remains as a long-term option. And then we need to pick which drug. When you start that treatment as soon as possible, we know it's linked with the best long-term outcome. And so after starting that treatment, tracking symptoms, keeping a check on what's going on and reviewing them as needed. We do those MRIs, perhaps 6 or 12 monthly, to monitor how things are going, and then checking with the neurologist or your MS nurse as well. So that leads us to look at, well, who treats MS? We do know that a team approach provides the best outcome for managing MS in a holistic way. It'll be interesting for you to look at this list and think of who you already have or who may be good to add to your team. We know that a neurologist is the architect here, but we do need other trades. Many people that are newly diagnosed, when they speak with me, they'll say, shall I change my GP? They're really good, but maybe they don't know much about MS. And should I find a doctor that specializes in MS? And there may be some GPs that have lots of patients with MS, but they can be pretty hard to find. So have a think about finding someone, if you don't already, that you can have a long-term relationship with and that is going to stick with you. Someone that's accessible, not just mobility wise, as in that you can get there, but what's the parking like? What are the hours like that they're available? How quickly do they book out? What do they cost? How's that going to work for you in an ongoing fashion? The same with the pharmacy is really beneficial if you do need to go on any kinds of medication to have the same pharmacy that you go to. They can help you with keeping your repeat prescriptions, reminders to refill, and also give you great advice when perhaps you're taking more than one medication and you need to check that they're all okay. If you go to an MS clinic, then you'll have access to an MS nurse, and they are a wonderful source of knowledge and support. And you may also have some family and friends and social support that help you along the way. We also have this term that we use called allied health. These are our allies in achieving really good health. So we can look at someone like a physiotherapist, which you may be very familiar with. They can help in maintaining function and movement, maximize your potential, but also help restore well-being. Even if perhaps you don't think you need one now, what a good idea to have an assessment to see, are there any injuries that I need rehabilitating, even from before your MS? Are there things I can do to improve my health and my mobility and my strength and to help me feel better for the future? There's also sometimes MS specialist physios or even neurophysios that you might be interested in. An occupational therapist is something that you may not have heard of before or been to. It's not your occupation as in your paid employment, for example, but your occupation as a person, all the tasks that you have to do throughout your day, whether it's sleeping or getting out of bed, brushing your teeth, could be cooking, having sex, driving, lots of things they can help with. So they help to overcome barriers that you may experience. They can help you with an energy management plan for fatigue, for example, or get you some gadgets for the kitchen. So it's really quite a broad range of things they can help with. Speech pathology or a speech therapist, they do help with communication, but also swallowing as well. A dietitian, we're really excited that we now have a dietitian on board at MS actually, and they help with the role of food and nutrition in supporting you with your health. Podiatrists can also be really helpful. They're experts in foot care and do lower limbs, but not just trimming the toenails. They can also really help you in making sure that you're not going to develop any issues later on. An exercise physiologist can help with clinical exercise intervention, making sure that the exercise you're doing is targeted and actually aligned with helping you achieve your goals. Also, a psychologist can be so helpful. They're experts in mental health, and they really can change the way that we think, we feel, behave, and react, and can be invaluable during a time of coming to terms with your diagnosis. Also, experts like a continence nurse. We have a continence nurse service here at MS that we're really excited about in New South Wales, actually. They can assess what's going on for you and work with you to develop a management plan, help you look at what you're eating and drinking, how that's working for you at the moment, what issues you're experiencing with your bowel or bladder, and then developing a plan to manage or eliminate those issues and then refer you on as needed. There's also formal services like the NDIS or an employment support service, which we provide, but other services provide that too, and even My Aged Care. So in terms of the treatment of MS, we discussed that there's disease-modifying therapy, and that is used to slow progression over time. I kind of liken that to sunscreen because we use it in a preventative way. It's proven to slow down the progression over time by reducing how many lesions you may have or how many relapses you may have. You may still have a new lesion or a relapse on treatment, but it wouldn't be nearly as bad as it would have been if you weren't on that medication. Often this medication can be immunosuppressive as well, because if you remember back to the start, we talked about the damage that can happen is actually caused by the immune system. So we need to interact with that somehow to prevent that from happening. We also have symptom management, which I liken to aloe vera. It's what you do about the symptoms after they've already occurred. That doesn't change how the MS will progress over time, but it looks at each symptom one-on-one. So if you have pain, we treat the pain. If you have fatigue, we look at managing that. And we look at those one-on-one to get a really tailored symptom management plan to reduce the impact this has on you. There's also a brain healthy lifestyle as well. And we'll look at that now to see if you're already perhaps living a brain healthy lifestyle, or maybe there are some changes that you can make now that are sustainable, but also will help you in the future to support your brain health. So this is what we call like lifestyle changes. So keeping physically active is really important. Higher levels of aerobic exercise are associated with faster information processing and preserved brain tissue volume. Like when we talked about the brain atrophy, this suggests that actually being as active as possible may help to preserve brain health in people with MS. Looking at your weight, we certainly know that being overweight, has a number of complications with health. But in terms of obesity in MS, we know that it's associated with higher numbers of MS lesions than those who maintain a healthy weight. So perhaps if you are someone who is overweight or living with obesity, you may want to have a think about if there are some changes that you're able to make either by yourself or with support to be able to help you get your weight under control. Keeping your mind active, actually working your brain. So things like education, reading, hobbies, or like artistic and creative things, they can help protect against cognitive problems in MS when pursued over a lifetime. So not just one thing this afternoon or this evening that's going to make a difference, but we're talking about keeping active over time. So really important that you keep your mind working. Avoid smoking. Cigarette smoking is associated with faster brain atrophy, higher relapse rates, and also increased disability progression when compared with people who have MS that don't smoke. So if you do smoke, it can be really, really difficult to reduce or quit. So do reach out for help, and it can make a great difference to how your MS goes. Also, watch how much you drink. We know that drinking alcohol in excess or higher than moderation, those unsafe levels, do have some negative impacts on how MS progresses over time. Also, keep an eye on other things. Take medications prescribed for you for other health conditions you may have. If you have other diseases, be responsible for monitoring them and taking the prescribed drugs. It could be that you have high blood pressure, maybe a heart disease or diabetes, or even high cholesterol. Those things can worsen the MS disease course if they're not well managed. And it also reminds me that you should also keep an eye on your health outside of MS, because not everything that happens to you will be related to MS. A good story that was shared with me by a client that was newly diagnosed with MS. She said, I went to my GP and I said, I have this kind of tightness around my tummy, my abdomen. It just feels a little bit funny, and I just haven't been feeling great in the last couple of weeks. And the doctor said, oh, that's your MS. That'll go away. Have a chat with your neurologist. And she said to me, well, it did go away in 9 months because she was pregnant. When she went to the GP just didn't even see someone that, could potentially become pregnant, just saw the MS. So make sure that whilst you're focusing on your MS, you also don't ignore the other areas of your health. How are we going, Nicola, in terms of questions? Is there anything we need to have a look at now, or shall we go into the top tips?
I think we'll just quickly have a couple of questions, Jane. So Kate has asked, how long do relapses usually last?
It's a good question, Kate. Certainly it's not, I would say, we're not looking at kind of days, as in we don't think a relapse would start on a Monday and end on a Wednesday. So I think you're looking potentially at weeks, if not a month or more, for the whole relapse to start, get to the peak, and have periods of recovery. And the recovery period can be quite extended. So it can sometimes be months and months and months before a neurologist, for example, would quite confidently say to you, okay, Kate, I think we're at as much of a recovery as we're going to get. So I'm sorry it's not a really precise answer, but I think it's because it is different for everyone, but really it can be quite a long time, more so in the recovery period.
Thanks, Jane. And another question we had was from Dinesh saying, is there a clear test to determine the type of MS, or is it the subjective view of the consultant?
That's a really good question. And I think a neurologist probably would be able to answer that potentially a little bit better than me. But I don't think there is a clear test. So I think, in the sense of showing someone an MRI, I don't think they would be able to say that person has relapsing remitting MS, whereas that one is primary progressive. So I think it is having a look at how the MS has behaved in terms of whether you've reported relapses before, and really looking at the whole picture to be able to determine. And sometimes it does take a little bit of time. So maybe it isn't clear at the first appointment you have with the neurologist, and they will, maybe change their mind later or use more information to be able to determine. And then there are some opinions as well that perhaps MS is more of a spectrum condition, that there's not these clear boxes that you fit into, that you might just kind of be a little bit in the middle. So it is a little bit fuzzy.
Thanks, Jane. And then people very generously shared quite a few of their symptoms, and I'll just pick out a few just to acknowledge. So people said that fatigue obviously came up a lot for people, blurred vision, migraines, weakness in arms and legs, heat intolerance, balance, numbness, speech and swallowing, and numb faces. So thank you, everybody, for sharing your symptom pictures with us. Appreciate that.
And I think it's so helpful because it does show you it can be all different symptoms in all different places. And I'm going to share some of my top tips with you now. And I'd love if you feel comfortable to share some of your top tips as well, because some of these I've learned from our clients. And I think we can really benefit from always having more things in our toolbox. I like to start by saying survive and then thrive. So focus on a few core elements for wellness. Sleep. You need to get some sleep. If you're having trouble sleeping, do speak with your doctor about it. Sleep dysfunction is very common in MS. You may experience difficulty in falling asleep. Perhaps your mind is really active, or perhaps your mind is calm, but you're physically uncomfortable. You might have restless legs or other symptoms that are really troubling you, so you can't actually fall asleep. And then maybe you're able to fall asleep, but perhaps you're waking up during the night. Again, is that your mind waking you up, or is it physical discomfort, or perhaps you're needing to go to the toilet more often overnight than perhaps you were before? So sleep is key and really a foundation for everything else to fall into place. Have a look at your diet. You don't necessarily need to do a huge overhaul of your diet, but certainly eating enough of the right kinds of foods is going to support you just to feel a little bit better, especially in this newly diagnosed phase, which also means that you should look at your fluid intake, plenty of water and limiting caffeine and alcohol, and also looking at physical activity. Can you do some kind of movement every day? I understand that some of these symptoms can really change the way that you're living your life, but is there a little habit that you can put into place that maybe at the same time every day you say, I will do something? Maybe it's a chair yoga video on YouTube. Maybe it's going for a walk, or maybe the best you can do is just go outside. And that's wonderful. Go outside every day, see if you can get some sunshine as well. Have a think about your mental health. How's it going? Do you have any coping strategies that you are using? Or are there things that you would have done previously in your life that helped you through a tough time? Can we call on those again? Have a think about the negatives and the stresses. Some of them we can't take away, but sometimes there are some things we can. So is there anything that can be delayed or postponed or even delegated at the moment? And then think about the positives. I always like to say to people that, we can't kind of take the negative stuff away at the moment, but if we add in some positives, some fun or enjoyable things, it can kind of just put the scales back in our favor a little bit. And I know you might not be feeling fun, but if there's something joyful or slightly nice you can add to your day or your week, that can really make a difference. Managing the medical stuff. Write everything down. Keep a running list of questions that you have. And if you live with other people that are a part of this with you, I love the idea of having a central place where everyone can just go and pop down their questions, maybe on the kitchen bench or on the fridge. And then they can be, reviewed before your next appointment with the doctor, and you can cross out the ones that don't matter and highlight the most important ones. But it really helps because the questions that you'll have for your doctor or your team will come to you at really unusual times. And instead of trying to remember them whilst you're in the shower or cooking dinner, you can just write them down and get back to your day. It's always really important to be honest with your medical team as well. It's really, really important because they can only help you with what they know. So please feel comfortable to do that. And taking someone with you to your importance can be really helpful. So have a think about that if that's not something you are already doing. And in terms of communicating with your team, your medical team, can you get some clarity around that communication? Can you ask them questions like, in between appointments, what kind of things do you want me to tell you about if something happens? How should I contact you? Is there a phone number? Should I send an email? Do I leave a message? And roughly how long would it take you to get back to me? Again, just so I understand, are you going to get back to me that day, or could it take a couple of days? Again, it just helps me feel settled in knowing what to expect. Also, if I think I'm having a relapse, what should I do? What kinds of things should I see my GP about, and what things would you rather handle? If you're unreachable, though, is there another person or service that you prefer I go to, such as a particular hospital? If I have a new symptom, how long should I wait before contacting you? Or perhaps it's COVID. If I catch COVID, do you want me to tell you? Do I need your help with maybe accessing treatment? So really good to ask those questions ahead of time. Manage your social environment. Have a think about who is helping at the moment and who isn't, and can we manage this? Different people in your life will be better at different things, so set barriers if you need to. Lots of people will be saying, let me know if there's anything I can do. So take them up on it if you feel comfortable, but a lot of these things can help. There may be practical things like meals or mowing the lawn, walking the dog, taking your kids for an afternoon, doing groceries or running errands. I certainly appreciate COVID does make some of these maybe not as appropriate right now, but think about what might be right for you. In terms of social things, can they organise a catch up? Do you want a Zoom catch up with them or a movie night? Maybe you both are at home, but you watch the same movie from your homes and chat about it later. Or even Netflix recommendations. Maybe there are some gifts that, wouldn't go astray. Maybe some new pajamas or an extra long phone charging cord for when you go to the hospital for your infusions, because the standard cords are never long enough, so that can be helpful. Maybe you ask for a goodie bag for your infusion so you've got snacks, or a nice letter to read after you start your treatment. And also have a think about communication. Don't be afraid to outline what you want or what you don't want to hear. Maybe you say, I don't want you to ask me about my MS every time I see you, or you can ask me about it once, or I'll bring it up if I want to. Maybe communicate who you're comfortable with knowing that you have a diagnosis, whether it's quite closed in a small circle or whether you don't mind everyone knowing. I've actually recorded a webinar called Learn About MS, and that's for your family and friends to watch. So if you'd like them to learn more about this and you don't want to be the one that puts the effort into explaining it all, then that's a great way for them to learn more about it. And looking at what to do and when, priorities. Be strategic with your time and energy because you only have so much. Think about if you need some more expert advice. What do you need to know at the moment that would help you make decisions that are important? Is there someone that you can ask, an expert that you can go to? Maybe with all the stuff that you need to do, you could use a categorizing method called the Moscow method. M stands for must do. These are things that absolutely must get done at the moment. S is should do. These are things that we should get to, but they're a lower priority than the must do. Then we have C, the could do. These are your nice to do. You'd like to do them, but if you don't get around to it, it's probably not a big deal. And then there's W, you won't do. These are things that just aren't worth doing. Maybe every year you sit down for 2 hours and review your insurance policy and call around to see if you can get a better price. Maybe that's something you ditch at the moment if you can afford to and just say, you know what, that doesn't have to be done right now. I'd be interested to know, Nicola, did we get any tips come through in the chat or any other questions?
No more questions or tips at the moment, but we would love to hear some of people's tips. I guess one tip I'd like to share, Jane, that when I've done wellness sessions, and I love all the tips you're giving, they're amazing, really, really insightful. But I love the one that people often put up, which is learn how to say no. And I think the counterpoint to that is learn what you want to say yes to and be very conscious of what you want to say yes to, but having that good boundary and those things you want to actually politely decline. Many people with MS put that up as a skill they've had to learn and found really useful.
Absolutely. And sometimes it can help to have a prepared phrase that you use so that you feel stronger and more comfortable in doing that. So it may be like, that's not going to work for me, or I can't do that right now, or I'd love to, but I don't have the capacity. And that's a nice one because it gives the person the option to just accept that or to say, can I take something off your plate, to make sure that you do have the capacity. But that is really helpful.
And
So,
a couple of tips have come in whilst we were talking, Jane. So
yeah.
Marcella has said a great neuropsychologist can be really
Mm,
helpful. And another tip's come in saying keep it simple. Small team
mhm,
of golden people is great. And then we've got another question, which I hope you don't mind me asking, but I think it's probably something that a few people are considering. It comes from Nellie, and she's asked, if you're diagnosed with relapsing remitting, what are the
mm.
chances of it turning into primary progressive?
That's a really good question. So, relapsing remitting MS uh, shouldn't turn into primary progressive, but it could turn into secondary progressive. I know that's a bit confusing. So, primary progressive was the type of MS that only about 10% of people are diagnosed with, and it's more or less a flat-ish line over time. Whereas relapsing remitting is those periods of relapses, and then after that relapse finished, we're in that period of what's called remission. So a kind of flat line, if you will. That can turn into secondary progressive, where there may or may not be relapses, but instead of a flat line, it's a slow increase over time. So it starts to symptoms increase over time, and there can be relapses there. I'm aware that there perhaps was a statistic that was previously applicable that said something like, or I might have forgotten now, maybe like 60% of people after 19 years will transition from relapsing remitting to secondary progressive. But that was before we had the treatments that we have now. So I can't emphasize that enough. The treatments that we have now, there's 15 of them, and they have not always all been available. We started in the 1990s with some of the injectable therapies, which worked, but not nearly as well as some of the drugs we've had that have come along more recently. So we now diagnose MS faster and treat it with more effective drugs, which means that perhaps that statistic probably isn't accurate of someone like yourself who has been more recently diagnosed and perhaps gone on to treatment. So the short answer is I don't know, but it is a possibility. But we do know that treating relapsing remitting MS can delay the time of when it transitions to secondary progressive or potentially prevent that. I hope that's helpful.
Thanks, Jane. That's great. That's really helpful.
And I think it's really good also to bring up the neuropsychologist, because we talked about that there could be a neurophysiotherapist, but actually there is such a profession as a neuropsychologist or a neuropsych. They're different from a normal psychologist, or what we call a clin-psych, a clinical psychologist. The clinical psychologist is the type of professional that you may go to every week or month and sit down and talk through what's going on, learn different strategies like CBT, like cognitive behavioral therapy, or work through things. Whereas a neuropsychologist, they're more focused, I would say, on the way that the brain is working and doing assessments and helping you either understand what's going on, maybe look at some new strategies, or even cognitive rehabilitation. So a neuropsych is not necessarily a psychologist that you go and speak to about neurological conditions, in an ongoing fashion. They're really helpful in doing those assessments and then understanding where to next, and can be really helpful. So I think that's probably a good lead into some of my resources. I have lots of resources. So if there's something that you're interested in knowing more about, don't hesitate to be in touch. But I've curated my favorites. If you're going to watch one thing, have a look at a webinar by Dr. Sally Shaw. Sally Shaw is a health specialist clinical psychologist, and she specializes in MS. So she nearly exclusively treats people that have MS, but she understands it really well because she has MS herself. So she really gets it. This webinar is called Take Charge and Become the CEO. It's not about business, so don't let that fool you. It's a really interesting way of looking at how MS is going to be in your life and how you will interact with MS. So I really encourage you to have a look at that. It's really interesting, and I've watched it many times. If you're going to read one thing, have a look at the brain health guideline. That's the orange slides I talked about. So those things are simple changes perhaps, or some of them not so simple, that you can make that over time will support your brain dramatically. If you're going to use something, have a look at this tool by UK-based MS Trust. It's called What's Causing My Symptom. You could go onto that webpage and you can click through and learn about what's causing my symptom, why does it happen, how common is it, is there something I can do to manage this, and how is it normally treated by other professionals, medications or allied health, and where can I go to for more information. So MS Trust is a really good website. You're going to do one thing, take it slowly. MS is going to be around for a while, so acknowledge your success and know that you are doing a really good job. Really, you are. The fact that you're here or watching this tells me that you really are doing a good job. And don't do it alone. Please don't be alone. Reach out for help. We are here for you, and you're never bothering us. Sometimes when people call into MS Connect, they say, oh, I've never called because I didn't want to bother you. You're not bothering us. Please call. So looking at where to from here, this is my last slide. I always talk to people about controlling the controllables. There's some stuff here that we just can't shift, but can you control what you can? So you can't control the wind, but you can adjust your sails. So that's what I'm going to leave you to have a think about whilst I hand back over to Nicola.
Thank you so much, Jane. Lots of really great information there. And I will send all of our attendees tonight a recording so they can play back and pick up some of the tips and things again. Some people have added some tips in as well, everything from, making sure you organise fun things to do for yourself and use the energy that you have to do things that you love. And a great tip about just get a cleaner. Just get a cleaner,
Yes.
which I think is really important. So
I really like that. I think that's such a good tip because I know sometimes, when it's not your choice to perhaps get some support, you may feel like there's a judgment there. I remember speaking in a facets program once, a fatigue program, and someone said, oh, but I feel like I should be able to do it all myself. I should be able to cook and clean and work and care for my children and my partner. And what will people think of me if I get a gardener? And I said, it's really funny you think of it that way, because if I saw my neighbour who I know well and they all of a sudden had a paid gardener that came, you know what I think? I think, gee, they're doing well for themselves. They must have got a pay rise. Look at them. They've got a gardener. Oh, wow. So people look at it in different ways. And so it's so important that you don't judge yourself so harshly. And I'm so glad that you have found something that works for you. And please, take that as a sign of encouragement that support can make a huge difference.
And I think also, Jane, in terms of resources, and you've got some great resources there, but also want to let people know, because we had quite a few questions about relapses, that you and I did a fantastic podcast series on relapses that you put together, Jane. So I'd really encourage people to go to our website, ms.org.au, and have a look at the podcast series or download from your podcast provider and have a look at the relapse series, because Jane and Jodie have put some fantastic information together there. So I'm just going to really quickly have a look if we've got any more questions that we'll address tonight. Jane has said, thank you very much for this event. It's really comforting to know that you're all there and we really appreciate it. And Alice and Nellie and Jonathan and Peter have all express their thanks. So from everybody listening, Jane, and from myself, thank you for your expertise, and thank you very much for being there on the end of the phone day after day for all the people with their queries and crises who have MS, that you're there with your colleagues answering those calls. So it's really important and we really appreciate it. So yes, lots of thank yous coming in, one from Rena and Kelly as well. So I just want to close with some very brief housekeeping for everybody, just as Jane said, to remind you of some of our services. We're here to help you with NDIS and with support coordination. As Jane mentioned, we have the wonderful MS Connect helpline where you can speak to an expert or a MS nurse advisor or to one of our social workers, for example. And also we do employment support. And for many people who are newly diagnosed, one of the most important things we can do is to provide peer support. So if it's useful for you to be linked in with somebody who is in a similar situation to yourself and managing well, similar age, maybe similar profession, then we can do that for you. So please do get in touch and let us help you there. And I think there's nothing quite like somebody who has that lived experience to help. We have a wonderful podcast series. One of the episodes there is an interview with Professor Jane Lechner-Scott, and it's all the questions that you wish you asked when you were newly diagnosed and maybe forgot to ask, or you asked them of your neurologist and then walked out of the office and promptly forgot. So I encourage you to have a listen to that if that's useful for you. And our webinar library has a webinar on just about every subject that's MS related that you can think of. So it's a great resource there for you. So just to finish off, well done for getting here tonight and for engaging in the webinar. We really appreciate it. We are here to support and to help you. The gateway to all of our services is 1800 042 138. Don't hesitate to call us. So thank you guys, really appreciate your company tonight, and we look forward to seeing you at our next webinars that appeal to you. And a huge thank you to you, Jane.
Thank you.
Jane. Bye everybody.